Hello, my name is Drew Lucas, and I'm a junior, second semester student at the Kramer School of Nursing. I've had the great opportunity to partner with Professor Brandy Stanley as my mentor. She teaches the adult mental health course for undergraduate nursing students and has an abundance of experience in the field. Today, I'm going to talk to you about my research and explore the stigma on mental health patients, and more specifically as it pertains to the nursing field. My research explores the question of when nurses develop a bias on mental health patients and if this occurs during nursing education. Although I have not completed my research at this time, I'll be diving into the background that led me to explore this question and my plans for research design. This photo that you see on the poster is how the general population typically visualizes mental illness. People usually associate mental illness with homelessness and drug use, but in reality, mental illness impacts individuals from all socioeconomic and cultural backgrounds, as well as education levels. 1 in 5 people will suffer from mental illness during their lifetime. Mental illness does not discriminate, but unfortunately, discrimination towards mental illness patients is widespread. Less than half the people suffering from mental illness will seek treatment due to this negative stigma. Research has shown Hello, my name is Drew Lucas, and I'm a junior, second semester student at the Kramer School of Nursing. I've had the great opportunity to partner with Professor Brandy Stanley as my mentor. She teaches the adult mental health course for undergraduate nursing students and has an abundance of experience in the field. Today, I'm going to talk to you about my research and explore the stigma on mental health patients, and more specifically as it pertains to the nursing field. My research just explores the question of when nurses develop a bias on mental health patients and if this occurs during nursing education. Although I have not completed my research at this time, I will be diving into the background that led me to explore this question and my plans for the research design. This photo that you see right here on the poster is how the general population typically visualizes mental illness. People usually associate mental illness with homelessness and drug use. But in reality, mental illness impacts individuals from all socioeconomic and cultural backgrounds, as well as education levels. 1 in 5 people will suffer from mental illness during their lifetime. Mental illness does not discriminate, and unfortunately, discrimination towards mental health patients is widespread. Less than half of the people suffering from mental illness will seek help due to the negative stigma associated with mental illness. This stigma includes the general public and their social unit, but also the healthcare community where they'll be seeking help. Healthcare professionals are in a great role to make an impact on mental health treatment. In fact, research has shown that the same adverse picture of the mentally ill that I described previously also exists in the medical environment. Healthcare professionals, including nurses, really have to have an unbiased view towards mental illness patients in order to properly prevent, assess, and treat mental illness in the acute setting as well as in the community. If they don't, it can have a direct and negative effect on provider interactions and patient outcomes. Additionally, the stigma on the mentally ill has extended the already existing nursing shortage. We know from current research today that the overall nursing shortage does exist. Research has said that overall nursing workforce is projected to grow by 7% in 10 years. That was in 2019 and is expected a 10-year growth, so in 2029. The field continues to grow, but there aren't enough nurses to fill the demand in all settings. Many factors impact this. Nurses are retiring from the field. Nursing schools cannot grow their enrollment numbers to train enough to keep up with the need. And the bigger the shortage grows, the more stress current nurses feel that drive them to leave the profession altogether. The psychiatric setting is affected by this because not only are current nurses retiring from the setting, new nursing graduates are not pursuing the field due to the stigma associated with these patients. Research has shown that nursing students are ranking psychiatrics as the least desirable field. It is found that nursing students carry the stigma that mentally ill patients are violent and that these students are uncomfortable providing competent mental health care. But why? When is this bias on mental health patients learned? Is it learned during the nursing education and training process? Are students bringing this bias on the mentally ill into their education process? My goal with my research is to explore these questions further through a qualitative research design. My interest in the psychiatric nursing field and this topic really came from a personal experience. My family has been impacted greatly by a mental illness diagnosis. I assisted a loved one desperately seek out the care that they needed, and we were faced with negative stigma and stereotyping due to that process. It not only increased our stress during the process, but also created a huge barrier to receive appropriate treatment and to receive it quickly. I know firsthand how the stigma on mentally ill can impact an individual's ability to get proper treatment. I truly believe that nurses are in a great role, as it is today, to be in the front line, the first line of care, to improve the quality of care patients receive, in addition to advocating for them altogether. So moving on towards my research design, I wanted to really explain the structure that I will have in my research and why I chose to use phenomenology. Phenomenology is a qualitative research design. I'm using it because it focuses on the study of an individual's lived experiences within the world and their search for meaning. It is about focusing on a person's experiences and the meaning of them. So really to take into account all of their experiences and to try to create meaning out of them. It seeks to describe rather than explain, and it allows me to gain valuable subjective data from participants and hopefully insight, as well as motivations and actions. It is important in this type of research to not only start with the clear hypothesis and to leave the question open-ended and explore. It is based on a lot of assumptions, but the biggest piece is that the investigators, which are the researchers, me, values play a huge role in the investigation, and that participants and investigators share knowledge and are partners throughout the entire process. My research design is created for me to complete semi-structured interviews, one-to-one with participants. By meeting privately with each individual, I'm hoping to create an open, comfortable space to explore the perceptions and background fully. Undergraduate nursing students are going to be interviewed at 2 different time points to track bias progression. The first time point will be when students are in their first 2 or 3 weeks of nursing school, so brand new, and the second time point will be students in their 3rd or 4th semester who are nearing graduation. All of my participants will be recruited through nursing organizations such as the Student Nurse Association and through recruitment flyers posted around the Kramer School of Nursing building. Participants will be given $5 coffee gift cards to thank them for their participation. Semi-structured interviews will be conducted in a private location following CDC guidelines for social distancing and masking. If participants are unable to meet in person, then I will be able to do it over Zoom meaning that they can do consent for a Zoom interview for it to be recorded. Consent will be obtained for participation and for audio recordings using the iPhone audio memos device. Consent forms will be stored for 3 years in a locked file and audio files deleted following transcription. Students will be interviewed until saturation is reached, and I anticipate interviewing approximately 12 students total, but because we will go until saturation is reached, that means that I will add more if it needs. Interviews will be coded and analyzed for themes afterwards. So on the right panel, you can see my interview guide. The interview guide is made with the purpose of directing the interviews, but leaving room for participants to explore their experiences and viewpoints with me, free from constraints. I will use this guide with all of my participants, in addition to probing questions. Probing questions are used during the interviews to get more information about an answer to clarify something. Examples of this is, tell me more about that, or how do you feel about that, or what do you mean when you say blank? I will use this interview to gather consistent information, but the semi-structured design allows me to use these probing questions as I see needed. It also gives me the freedom to word questions spontaneously and explore topics in more detail as they come. All of the questions displayed here are focused on the individual's knowledge and experience within mental health, as well as their thoughts about the required mental health clinical rotation. I am hopeful that this guide will lead the conversation around mental health, stigma, and explore if the individual does have a bias towards the mentally ill in these patients, and when this developed, either before or during education. I should note that my study does hold the risk of introducing bias to participants that maybe they didn't see before, and that there is a limited psychological risk involved. It is unlikely, but there will be questions that explore experiences with mental health and that might trigger an emotional response in those who have been exposed to traumatic experiences. Counseling services will be available to participants as needed, meaning I will have brochures for the on-campus counseling services ready and prepared just in case someone does become triggered. I'm excited to begin my research this summer. I appreciate you listening and enjoying listening today, and I really, really, really enjoyed sharing my research plan and interest with you all. Please do reach out to me via email, provided on my poster here, if you have any questions to my research. You may use my QR code to check out my references where my contact information will be available as well. You might reach out to my mentor, Professor Brandley Stanley, with any questions that you might have. Thank you so much.